today's activity is a direct result of the monies that we received from TVO a few months ago, where the mental health project was approved. And the purpose of the mental health project is to be able to ensure that we improve mental health on St. Martin, and improve mental health meaning improve the fact that the civil servants, so our staff of VSA, as well as the community, is aware of the services that are available, and that we are aware of what services we are supposed to provide. Today's session was actually aimed at grounding us, reminding us that we too are people, we too are citizens of this community, and we too need to take care of ourselves in order to take care of the community. That's the purpose of today.
Blessings, St. Martin. My name is Richinel Brug, Minister of Public Health, Social Development and Labour. Today we are busy executing one of many planned projects, as explained by my colleague Fenna Arnell, pertaining to mental health on St. Martin. Today we are focusing on our staff, because at the end of the day, we have to ensure that our staff are in good, sound mind and make sure that they take care of their mental health as well, in order that they can better serve the community of St. Martin. It is one of many activities that we are going to do moving forward, especially seeing the growing need of mental health services in our community over the years. When taking office, I made mental health a priority, and I will continue to do so and continue to do any and everything possible within the legal means in order to ensure that healthcare for mental health patients and healthcare in general is improved for the people of St. Martin. I am very, very, very proud of all the staff of VSA for all their contribution and all their hard work and patience that they have executed when it comes to doing their job, when it comes to actually providing service for the community of St. Martin. It is, however, time for us to pause, breathe, take care of our own mental health, and then continue the task at hand. The VSA staff does this not because it's a job. They do it from the bottom of their heart. I see it every day when I see them provide service to the community of St. Martin. So we will continue providing that service on a higher level, as well as we continue to take care of the VSA staff, who will continue to take care of the people of St. Martin.
Hi, my name is Kevin James. I'm the Senior Officer for the Department of Community Development, Family and Humanitarian Affairs. Mental illness is just as common as any physical injury you may have, only it is invisible. It can affect everyone. It's not only the persons that are obvious that you see on the streets. It can be someone of your colleagues, it can be a family member, it can be a friend, it can affect anyone. And it is something that, as our department, we are constantly looking for ways to be sensitive to what persons are going through and find ways to support them and to help them. Just as if you see someone sprains their ankle, you'll help them get to the emergency room. In the same way, look out for those persons that are having emotional challenges, that are having mental struggles. Be sensitive, reach out a hand and try to help them. That is what we do, and we can only do it together as a community.
I'm Louis Labaist. I'm the writer and director of this short skit, which I entitled Eyes Without a Face. Approached by the Department of VSA and Fenna and her team, I was asked to develop something that would kind of explain and would expose. I think that's a better word. All the elements and struggles and the emotions attached with mental health. Given that task, explaining this briefly, what I did is decided to peel back the curtains and take it from the point of departure where I bring and where I create characters using their pain and their situation, but not using their names. And of course, playing the roles was a very challenging one, taking the time into consideration. very proud of my cast, in particular those cast members that played 2 roles in such a short time. And it would be an injustice if I didn't mention that Rita Gums, the narrator, explained the whole sequel of events, and it couldn't be done without the narrator, otherwise it would have been an hour, 2 hours long. And I thought that she did a fantastic job. Sylvina Gums portrayed 2 roles. She portrayed a role of a mental health person, but then she also portrayed the role of a loving relationship between herself and James. James played 2 roles as well, a mental health individual and an individual in a loving relationship with Stella. And having said that, in a nutshell, hopefully the message was delivered. And what we did is we didn't hide it. We didn't bury the head in the sand. We didn't play ostrich, but we put it out there and we peeled back the curtain, and hopefully it was enjoyed.
Hello everyone, I am Rita Gums, and today my role in this little theatrical performance for the Ministry of VSA, I was a narrator, as Louis mentioned, and though I was narrating the story because we didn't have the length of time to put on a 2-hour production, I was also playing a character involved in the other characters who understand their pain, what they're going through as mental health patients. So I share their story. As an individual in the community, I see and cross persons with mental health challenges every single day. Every day I pass someone in my neighborhood, and I have been in education. I have also had former students that I pass sometimes on the road that we're still helping out. So mental health is very deep to my heart when it comes to the well-being of everyone. I see it, I live it every day, and I want to be a part of the support team that works with these persons.
I'm Sylvina Gums, and my part in this short skit was Stella. It showed how Stella became a mental health patient because of love. It gave me a deeper understanding of how people can lose themselves and become mental health a person. And it gave me a deeper compassion and understanding for these people.
Hello, my name is Earl Duzal, and I played today 2 characters. I played James as a loving husband, but as you can see in portray later down, he becomes very mentally abusive to his wife, which causes her to trigger, and that leads her to her mental health situation. And I also played Danny, who's a mental health person. Me being a seasoned actor, I had to do research on it. I never played a mental health person before, but when I got into character today, it brought so much different emotions to me that right now I even still feel emotions and the butterflies inside of me. But we really need to look into this situation and help all our mental health people, because every day you go out, you see a new face on the road and you're like, what's going on in this place? And it's sad to see that we have a lot of locals who's going into this situation, but also we have a lot of foreigners who come here and it's like, what's going on? So I'm glad to get an opportunity to portray a character like this, but I hope the message was sent and people understand what people go through being a mental health person. Thank you.